Wa alaikum salam wa rahmatullahi
wa barakatuh.
So today, thank you all for joining our Women's Forum and Sisters Forum. For today's event, we have our mother, sister, who is also a senior clinical pharmacist who specializes in women's families' health with focus on HIV, sexual health, contraception, and family planning. Hadia Sherifat Kamaldin. Thank you for having us today. You can proceed.
Okay, thank you very much. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على سيدنا محمد وعلى آله سيدنا محمد وسلم. Thank you for that beautiful introduction. May Allah make it easy for all of us. Today we're going to talk about something very important and something that is quite sectional to women and women only, and our ladies and our young ladies, I would say. May Allah make it easy for all of us. If I speak fast, I speak slow, whatever one is happening, please just let me know. I can always go back. So this is a family gathering, and we are here to learn. And please, if you have a pen, paper, start writing your questions as we're walking along. And if there's anything that you want me to go back to, let me know later after the talk. So may Allah make it easy for all of us. Inna alhamdulillahi nahmaduhu wa nastaghfiruhu wa na'udhu billahi min shururi anfusina wa min sayyiati a'malina. Allahumma salli ala sayyidina Muhammad wa ala ali sayyidina Muhammad kama sallaita ala sayyidina Ibrahim wa ala ali sayyidina Ibrahim innaka hamidul majid. Ya ayyuhallazina amanu taqullaha haqqa tuqatihi wa la tamutunna illa wa antum muslimun. May Allah continue to be with all of us. Amen. Today we're talking about contraception, family planning.
Can everyone just please mute if you are not Nura food. Mute your phone, please. Thank you very much. Sorry, ma'am.
So today we're going to talk about contraception, family planning, menopause, and we're going to have a brief chat together about each preparation. So contraception, we know that this family planning, we have a lot of controversial issues with our sisters, and we're always thinking about what does Islam say about it, what does the scholar say about it. We can't find anything in the Quran, neither can we find anything that we need to hold on to. So this has been an issue for a while, and there's been a lot of scholars' opinion about contraception and family planning. So I have divided this section into 4 sections. So we're going to combine contraception and family planning together and discuss the whole issue in one go. Then we're going to go into menopause. We know we are women and we are hormone verified, I would say. So our life depends on the hormones within our body. It is the hormone that is building us up as women. It's the same hormone that causes menopause. So we're going to talk about menopause as well. So while we finish, then we go and conclude with each preparation. Each preparation, then we go into question and answers. So may Allah make it easy for all of us. Amen. So contraception and family planning. Birth control. Birth control. Some people call it birth control. And it's also known as contraception and fertility control. We know what fertility is. We know what birth is. So those are methods or devices used to prevent pregnancy. So when you're talking about birth control, it's anything that you use to prevent pregnancy. Keeping in mind that when we're talking about contraception and family planning here, we're talking about people that are legally married. We're talking about couples. We're not talking about people that are just dating without nikah. We're talking about people that have they are legally married, their husband and wife. So planning and provision of birth control is called family planning. So when we are planning it and with our husband, and as how do we space our children, that is called family planning. So today, what are the Islamic we'll start with the Islamic perspective of contraception and family planning before we go ahead. Is this allowed? Even if it's allowed, what is the scholar's perspective? What have we heard about it? What do we know about the Islamic perspective of contraception and family planning? Islam doesn't prohibit birth control and contraception as long as there is a valid reason to take such a step, and the method used is not causing any harm to the couple. Once the child is conceived, it is a sin to abort it unless there's a threat to the life of the mother. So the basic knowledge that we wanted to put in our mind is Islam does not prohibit birth control, nor does it prohibit contraceptives as long as there's a valid reason for it. So where are we going? Purpose, contraception, and family planning. Muslims, as Muslims, we build a strong family and community bonds. That is why we're here today. We are forming community network inclined. We work together as one. The same way we start a family with our husband, and our husband start a family with us as their wives. So as they welcome children, it's a gift from Allah. That's the way we see it as Muslims. Marriage is encouraged in Islam, and raising children is one of the main purposes of marriage in Islam. Few Muslims choose to remain child-free by choice, or they decide to delay it, but many prefer to plan their families through the use of contraception. So why contraception and family planning? Family planning is the private measure to space or regulate the family size for health or specific reason which is permitted in Islam. So it's a means where we space our children. We don't want a situation whereby we continue to have children every year, and the woman is tired, there's no enough resources, the man cannot go out to work because he has to take care of the children. So family planning as a private measure to space or regulate the family size for health or specific reason is permitted in Islam. So what are the evidence for this? In the early area of Islamic world, Islamic medicine has known about birth control for centuries, and it has referred to different methods of contraception. So Islam is strongly pro-family and regards children as a gift from God. So when it's time to space our children, Islam gives room for it. Although we can say there does not exist any Quranic verse or hadith that directly talk about contraception or family planning straight like that. But however, according to one tradition, the companion of the Prophet Muhammad ﷺ reported that they used to practice azl, which is the interruption of intercourse to avoid ejaculation. So that is the evidence we're going to use today to support family planning between married couples. So what are the Islamic evidence and what are our scholars' views about family planning and contraception in Islam for our sisters? Islamic evidence indicates that it is permissible to delay having children. As Jabir ibn Abdullah, may Allah be pleased with him, said, we used to engage in coitus interruptus as a form of contraception at the time when the Quran was revealed. It is narrated by Buhari and Muslim. You can see the quotation there. Coitus interruptus means ejaculating outside the woman's. Okay, that's fine. Okay. Okay. So this evidence, this hadith is quoted in the as an evidence that is permissible to space our children in order to give them a proper Islamic upbringing, and the woman can have time to take care of the children as well. So if a woman has a lot of children, it is difficult for her to give them a proper, one child after year, every year, proper Islamic upbringing, taking care of them. If there's so many, there's nothing wrong with her taking sometimes space in her pregnancy in order to achieve this important purpose of child upbringing. So the pregnancy will not adversely affect her and our children, as Allah has permitted coitus interruptus for us between couples. So this is the evidence that we're going to use today for family planning. Another scholar view is another sheikh has said taking contraceptive measure is permissible in principle. because the Sahaba, as I've quoted earlier on, used the method of coitus interruptus during the time of the Messenger, sallallahu alaihi wasallam, and it did not forbid them to do this. But it is contrary to what is preferable, because having a lot of children is something that is prescribed and it is desirable. But we're not saying that because we know it's permissible now, we will now decide that we are not having children. So these are the evidences from the Quran, from the Hadith, that gives us the permission that this is permissible. Another Islamic fiqh council years ago in Kuwait determined the following sentences. It says, it is not permissible to promulgate laws restricting freedom of couples to have children. We should not tell them not to have children. And secondly, it is prohibited to completely eradicate the ability to have children in the case of either the man or the woman, which is known as sterilization. So people should, Islamically, it is not right to determine to sterilize ourselves, that we're not going to have children at all. So long as there are no necessary reason, the wife is fine and the husband is fine, Islam prohibits sterilization according to Islamic standards. Thirdly, it is permissible to use temporary methods of birth control for the purpose of spacing pregnancy or preventing pregnancy for a specific length of time. If there is a valid reason, according to Islamic teachings, for doing so, according to what a couple decide on the basis of mutual consultation and consent, on condition that this does not lead to any harm to the mother or the husband, and that method used Islamically is Islamically permissible. So contraception is allowed in Islam. So Allah knows best. So going through all these, the three basic scholars talk, we know that we are allowed to space our children by the means of family planning. So how do we choose this contraception that we have everywhere nowadays? How do we know which one that is Islamically permissible? Any contraception that will cause sterilization is not Islamically permissible. Any act of contraception that is going to harm the woman is not Islamically permissible. So let's go a little bit about abortion, because this is people normally use the same word together. They look at contraception as an abortion, which is not the same. The abortion in Islamic perspective view abortion as shaped by the ideas as well as the opinions of legal sterilizer. The features believed to be a living soul after 4 months. So if the mother is not well and there's a determination for her to have an abortion with that particular child, this has to be determined before the child becomes 4 months. Because when it becomes 4 months, Islamically, the child is already a human being. And it's not allowed, except in extreme circumstances that we know that it's going to cause harm to the mother. And this is part of Islamic perspective, also correlates with the guidelines given by the Royal College of Obstetricians and Gynecologists, which says that over 98% of abortions are given on the grounds of there being a risk to the health of the mother, with only a minority pregnancy terminated on the grounds of fetal abnormalities. So we can see that we're on the same plane. We are looking at the scientific evidence and we are looking at the opinions of the scholars. So may Allah make it easy for all of us. So let's go into contraceptions. We know we have used, some of us are using different types of contraceptions, but there are so many of them all over there. If you visit, some of us have visited our family planning clinics, we know what all these are. And they normally give us a leaflet. You normally see a nurse that is specific and that is specialist in the field, and they will take you through the side effects. They will take your blood pressure. They take blood tests so that they know the particular contraception that fits you. This is why we cannot say all of this today. But at the end of the day, I'm going to refer you to the contraceptive clinics. But what we want to say is, whichever contraceptive method that you choose, look at what we have said before, that it's not the one that's going to sterilize you, and it should be the one that is of less harm. When you see your family planning consultant or your clinician or the nurse, they're going to take you through the different type of contraception that is available, the side effects, and looking at your own blood, your comorbidities. If you have diabetes, high blood pressure, whatever you've got, they will use that to determine the kind of contraception method that you are able to have. So what are those type of contraception that we have? We have the condom, we have the female condom, we have the oral contraceptive pills, we have the hormonal ring, we have the UID, we have the injection, we have the surgical sterilization that we said that it is not allowed in Islam. So we have the implant. Then we are talking about the coitus interruptus as well. It is used naturally. Then some people use calendar method to determine when they meet with their spouse. There's a lot of vaginal contraception as well. There are diaphragm. There's so many of them out there that will have so many side effects, and some. Then we have to weigh the side effect on individual basis, and this can only be done with your clinician. This is why if you want to do any contraception, you don't just go into the shop and pick it. You have to book an appointment. They have to check your blood pressure. They have to look at your bloods and see the way you are before they can choose the right contraception for you. So these are the birth control methods. You can see them. There's so many of them here, and each one of them adds their own side effects. That it depends on individual circumstances. So may Allah make it easy for all of us. Amen. So the question is this: how do contraceptives work? So what they do generally is they delay ovulation. Okay, in different ways. They work in different ways to fit into the systems. So I will send you a link into the various link into how to use different types of contraceptions, the mode of action, how they work, and how you can use them before the end of this talk. So which contraception is best for me? I'll just highlight the a little bit about what we need to do. The only 100% certain way to avoid pregnancy is abstinence. If you don't touch a man, if you don't have anything together, no pregnancy. So once you are able to have intercourse with a man, then you have to, and you're not ready to have a child, you have to use a contraception once you're married. But if you're going to have sex, the best way to prevent pregnancy is to use a very effective birth control, like the IUD or the implant. But at the same time, I will refer you back to your clinician, the family planning clinic. They will take through all the processes and explain each one of them to you. But just remember that Islam says the only one that is best for you, the one that is safe for you. And we're not allowed to use any contraception that causes sterility. Some birth control work better than the others. The kinds of birth control that works the best to prevent pregnancy are the implant and IUD, and they stay longer. They are also the most convenient to use and the most foolproof. But this is based, again, on individual circumstances. So we have to look into individual circumstances before we can say this one is the one that is good, or this is the one that we can use. Other birth control methods like the pill, ring, patch, as I've shown you in the picture, are really good at preventing pregnancy, but if you use them perfectly well, so you have a routine. If you're on the daily tablets, make sure you use them as prescribed. If you're on the injection every 3 months, make sure when it's due, you have to go and see your clinician to take another one. But people are different, and those methods are easier to mess up their implants and IUD. So we have to be careful whichever one we're doing. So we have to be strict to the instruction. We have to look at the instruction, and we have to watch ourselves in case there's changes in our body system. Because of side effects, it can harm us or harm our body. So we have to be careful when we start using all those contraception that to be safe for us all. The hormonal contraceptives, I need to quickly go into this. There's some of them that are hormonal contraceptives, and those are the pills, the patch, and the vaginal ring. All of this one contain a small amount of man-made estrogen and progestin hormones. Those hormones work to inhibit the body natural hormones to prevent pregnancy. So they inhibit the hormones that support pregnancy. That's the way they work. And this hormonal contraceptive usually stop the body from ovulating. So once you stop ovulating, that means you cannot be pregnant. So hormonal contraception also changes the cervical mucus to make it difficult for the sperm to go through the cervix so that to find an egg. So there won't be fertilization. So this is the way all these contraceptive works. So hormonal contraceptives, again, can also change the lining of the womb, which makes it unlikely for the fertilized egg to be implanted. You know, after fertilization, the egg will implant itself into the womb. But the contraception will thicken the wall of the womb to prevent that implantation of pregnancy. So that is the way the hormonal contraception works. So if we have looked at the different type of contraception, we have had discussion with our clinicians, they have taken our blood pressures, they have taken our blood samples, they have we have been able to choose one that is not harmful to us and it's not going to make us sterile. There are some side effects that normally comes with most of these contraceptive pills. But there are some side effects that I need to highlight today, that those side effects majority are not serious. But if we have other side effects are less common, but some of them that are serious, and if you notice any one of them, you have to contact your doctor immediately. And these are nausea, weight gain, swollen and sore breasts, small amount of blood or spotting in between periods, lighter periods, mood changes, abdominal pain, chest pain, headaches, eye problems, swelling or aching legs and thighs. I'm aware that some of our sisters are already on some contraceptive pills here, but it's good for us to go through all those things occasionally to be sure that most of whatever we're having a lot of weight gain, we have swollen breast, or we have lighter periods, or we're bleeding in between periods. All of those that I've highlighted on this page, you need to speak to your doctor. So when choosing, as I said earlier on, we have to follow Islamic guidance as stated above. It is super important to make sure that you birth control the right way. This means you can't forget to take your pill, as I said earlier on. You have to follow the instruction. You can't forget to change your ring. When it's time to change your ring, please go and change your ring. Sometimes all of them have expiry dates. So it's like if you don't change them on time, you're taking an expired medication. So or get your shoot on time. I mean, people that are on injectable contraception, when it's time for you to go and take them, you don't take them, you get pregnant. So you'll be at risk of pregnancy. So the best method of birth control for you is the one that you always use correctly. So when you're speaking to your clinician or your nurse or your family planning specialist, speak to them and choose the one that is more convenient and is comfortable for you. The one that you know you can take correctly and you really understand the way it works. And visit your family planning clinic all of the time if you have any problem. So may Allah make it easy for all of us. So those are just the basic principles about contraception. And as we go along, if you have any question after the talk, then I will be able to take questions as we go along. I know I've not been able to go through all of those pills and the way they are. There's so many of them. And if you want, after the talk, then we can go through some of them so that we can explain the way they work, the side effects. But we quickly go through, go now into menopause. Menopause. We know this as women, we go through so many things in our life, and menopause is one of the things that as women that we go through, either we like it or not. And it can start as early. They can start as early as 40s. Even we're seeing ladies of about 30-something years of age now having symptoms of menopausal symptoms, 40 or 50s. But the average age in the US now is 51, in the UK is about 50 to 52. So menopause is a natural biological process. But the physical symptoms such as hot flushes, emotional symptoms of menopause may disrupt our sleep, lower our energy, and affect our emotional health. There are many effective treatments available, from lifestyle adjustment to hormonal therapy. So when we are at that age between age 40 and 50, we can see changes in our period. We can see so many things, hot flushes. Sometimes we get aggressive for no reason. Sometimes we get annoyed for no reason. We have our period, we stop, come back, go, come back. But menopause is that time at the end of menstrual periods. We cannot say it's menopause until if you have gone without your period for 12 months. So if it goes for 2 months, you come back again, it's not stable yet, you have to still use your contraception. If you're not, you're at risk of getting pregnant, so you have to be careful. So the general symptoms on here for menopausal symptoms, in the months or years leading to menopause, we call it perimenopause period. You might experience these signs and symptoms. Irregular periods, vaginal dryness, hot flushes, chills, night sweats, sleep problems, mood changes, weight gain and slowed metabolisms, thinning hair, dry skin, loss of breast fullness. Symptoms including changes in menstruation are different for every woman. Most likely you experience some irregularity in your period before the end. So those are the symptoms that we see generally. Menopause, premenopausal, and menopausal, it comes and goes in people, regular. So many things happen. When you start seeing all of these things often, please try as much as possible to see your clinicians. They will be able to give you the best advice, and they will be able to give you the best advice and what you need to do. So there are 4 stages of menopause. So we have stage 1, we have stage 2, we have stage 3, we have stage 4. So stage 1 is premenopause. It starts when a woman enters her reproductive years and ends with the first signs of menopause. The beginning of premenopause can be defined as the first menstrual cycle. Just give me 1 minute, please. So the first stage is the premenopause, I just said, and it starts when a woman enters her reproductive years and ends with the first sign of menopause. The beginning of premenopause can be defined as the first menstrual cycle. And the second phase is called the perimenopause, where the estrogen level begins to decline and fluctuate, causing unpredicted periods in and out. They go and come, they go and come. It can last several years, and common symptoms are hot flushes, dry skin, and irregular periods. So when you start seeing hot flushes, dry skin, and irregular periods, you know that something is coming up. You're at perimenopausal stage. So premature menopause, there's something we call premature menopause. Some women may experience early menopause due to illness, genetics, or medical procedures. Symptoms tend to mirror perimenopause. So it depends on the symptoms that will determine if it's perimenopause or premature menopause. So whenever you have all those symptoms that is persisting and persisting, try to book an appointment with your clinician and they'll be able to determine which one is this. So the stage 3 that we're going to look into is menopause itself. So it represents the end of stage of natural transition in a woman's reproductive life. The ovaries stop producing eggs and a woman can no longer get pregnant naturally. So it is marked by the total cessation of the menstrual cycle for 12 months or more. So when your menstrual cycle stops for 12 months or more, so we know you have reached that stage of menopause. So what we just said is that it represents the end stage of a natural transition in a woman's reproductive life. The ovaries stop producing eggs and a woman can no longer get pregnant naturally. It is marked by the cessation of the menstrual cycle for 12 months or more. So that is the menopause itself, and that is the stage 3. So the stage 4 is the post-menopause stage, which refers to the stage after menopause occurs and lasts the remainder of our life. And due to decrease in estrogen, there's an increased risk of osteopenia, osteoporosis, and heart disease. So we know that we can see that our mothers, after some time, they will continue to say, I have osteoporosis, I have pain in my joints, I have pain in my bones. It's the reduction of the estrogen in the system and the postmenopausal stage in our life that causes all of those things. So these 4 stages, we need to know them as women so that when we experience any of those symptoms, we know that something is coming into our life. So we've talked about premenopause, we talked about perimenopause, premature menopause, menopause itself, and postmenopausal stages. So diagnosis, how do you diagnose menopause? The signs and symptoms that I've just talked about is enough to diagnose that something is happening. Okay, they are normally enough because they will continue to come. If you have concern about irregular period, hot flushes, tiredness, in some cases, some further evaluation may need to be recommended. Speak to your clinician, book an appointment with your GP, and they will be able to help you out. Sometimes some tests specifically aren't needed to diagnose menopause, but under certain circumstances, your doctor may recommend some tests, blood tests to check your level of follicle-stimulating hormone, thyroid-stimulating hormone, and to be sure of the level. These levels of follicle-stimulating hormone and will tell us what is happening in your system. So when it's getting lower, we can know that menopause is setting in. And the thyroid-stimulating hormone, because an underthyroid can cause symptoms similar to those of menopause. So we need to be sure that the thyroid gland is balanced as well. So those are the tests that the doctors need to do, just to be sure that is either you are experiencing menopausal symptoms or something else is wrong. Some over-the-counter home tests to check follicle-stimulating hormone levels in your urine are also available, and you can get them in some pharmacy. But what I would recommend is if you try them at home, try as much as possible to go and see your clinicians as well. So what are the treatments and managements available for menopause and menopausal symptoms? Menopause requires no medical treatment. Instead, treatment focuses mainly on the signs and symptoms. If you are experiencing hot flushes, so we're looking at the signs and symptoms. If you are experiencing tiredness, we look at the signs and symptoms. So, I mean, treat them just to prevent so many other things that might set in if those are not being treated properly. There's so many treatments that we normally do. When you get to your clinicians, they're going to recommend some treatment if you need them. There are some hormone replacement therapy. We have vaginal estrogen. We have low-dose antidepressant. We have some gabapentin that can be used, clonidine medication to treat osteoporosis for our adult lady. Okay. So medications to prevent or treat osteoporosis, depending on the individual circumstances, doctors may recommend medication to prevent or treat osteoporosis. Several medications are available and they can reduce bone loss or risk fractures in our elderly bodies. So your doctor will be able to prescribe vitamin D supplements to help strengthen your bones. So that's why I keep on saying, don't self-treat at home. Don't use what your friends have used before. Try to see your clinician. This is very, very important for us all. And before deciding on any form of treatment, as I said earlier, talk with your clinician about your options and the risks, side effects, and everything that will benefit you. Review your options yearly as you need, and occasionally you might have to change your treatment as time goes on. So this is the end of the presentation on contraception and family planning, menopause. Then, and the last bit that we wanted to talk about today is about Eid, preparation for Eid. So may Allah spare our lives till then and beyond. This is supposed to be our last talk today, but I'll just quickly go through it, then I can take questions, and then we can have an interactive section. So preparation for it. The first thing that we normally do traditionally is to order our ram if we can afford it. And as our ladies, we know we are preparing so many things at home, our clothes, clean the house and make sure the house look different. This is because you're home at Eid, let the children feel that they are having something special. Okay, and we can have visitors that will need to come in, something good, something different. So change the home, put decorations on, rearrange the tables, rearrange the kitchen, get in something more spoons, more plates if you need them. Add a beautiful additional touch to the house. Buy gifts for your children, buy gifts for your husband, buy gifts for your wife. Prepare a beautiful and healthy meals. Get beautiful clothes for the family. Do a lot of sadaqah. Follow all instructions with relation to COVID-19. If you are going outside your home, wear your masks all of the time and keep safe distance. And remember me in your dua. So that is it for us. Rabbana fi dunya hasanata wa fil akhirati hasanata wa qina azaban nar. May Allah continue to be with us. May Allah continue to keep us healthy. May Allah continue to protect us and our family. Allahumma anta salam wa minka salam. Tabarakta ya zal jalali wal ikram. Amin. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت ونستغفرك وأتوب إليك. So that is the end of my talk today. If there's any question, any contribution, may Allah make it easy for all of us. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Alhamdulillah. Alhamdulillah. Alhamdulillah rabbil alamin. Ẹ ṣé gan ni púpọ̀ Alhaja. This message is Sister Mistura. Wọ́n bá ti ní àwọn question tí wọ́n máa fẹ́ bá wa coordinate kí wọ́n sọ. Sister Mistura, over to you.
Salam alaikum. Ẹ ṣé gan ni ma. Is ṣé ẹni tó bá ní question ẹjọ́ put it through sí messaging app níbí báyìí. Okay, question kan. Question kan tí mo ní téèyàn kan sọ ní pé ṣé ó wà regular kí èèyàn máa bleed tó bá wà lórí contraceptive?
Bẹ́ẹ̀ni, téèyàn bá wà lórí contraceptive, there's probability there's going to be bleeding. So there are two ways to cause the bleeding. Is either there's an implantation or there's a problem with your contraception, which is why if that occurs, you have to go to your clinicians as soon as possible. So when you start bleeding, while you're on contraception, you have to speak to your doctors as soon as possible.
Hello, sir.
Okay, èèyàn kan tún béèrè. Assalamu alaikum ma. Ẹ ṣé ma.
Alaikum
Èèyàn kan tún
salam.
béèrè pé is there any supplement you can recommend for menopause?
What we normally recommend is a natural thing that normally happens. So people normally take a lot of multivitamins, but I would say people should eat very good diet. So people have to eat good diet, very rich in vegetables. So we have to eat healthy. Healthy diets are more important. But we can always take multivitamins to support ourselves. But if we still feel that our sign and symptoms then it will be good for us to go to GP support rather than going to just take any tablet. So may Allah make it easy for all of us.
Hello, mommy,
Question kan tún ti wọlé.
Okay.
Wọ́n ní pé
okay, mo ní kán bá yín bí ẹja
ṣé is it normal? Ṣó normal fún teenager láti miss period fún 7 weeks?
The sequentials of Bashiman calculate the period I will be medically is that our me is 20 days, 22 days, 23 days, 20 up to individual. So to change, regular, we need to speak to our clinicians. Actually, I want more. Because there's something they call, sorry, I'm just a bit, so There's something they call. Just give me 1 minute. So there's something they call that affects the if we need to work with our teenagers and monitor their period, because we need to be sure that everything is happening the right way. So if a teenager has missed a period for anything more than 2, 4, 5 days, regular by normally, so that means to reduce here. But you are regular, it's advisable to speak to your doctor. But if the teenager is not well or is on any medication, maybe high blood pressure or for anything, low medication for any ailments in your mind, then it might affect the period. Then mood too as well normally affect the period as well. So we have to look into all those things. I hope I'll be able to answer that question. Assalamu alaikum.
So question kan tí wá pé báwo ni èèyàn ṣe lè prevent hot flushes?
Hot flushes is as a result of a naturally hormone imbalance happening within the system. You see, as we have said earlier on with the slide, one of the things the hormone level estrogen has been reduced in the system, the body. The body reduces the hot flushes follow me. And in cotton fire, hormone to reduce here. So continue. So what is happening? What is going to happen is that if it continues, we have to get to the doctors. There's a lot of like hormone replacement therapy, or there's some other multivitamins that people use, and the doctor will prescribe, and it works to reduce the hot flushes here. But there's no, I would say there's no like a specific treatment for it. We just need to work around it and manage that particular condition. I hope I'm able to answer that question.
Yes, ma. Okay. Question continuity again. Wọ́n ní pé ṣé ó wà okay fún teenager láti máa ṣe period fún more than 8 days in every month? So kí teenagers máa ṣe period fún ọjọ́ mẹ́jọ every month.
No, Sherry. Àwọn obìnrin ó yàtọ̀ síra wọn, ẹlòmíì ìjọ mẹ́ta, ẹlòmíì ìjọ mẹ́rin, ẹlòmíì ìjọ márùn-ún. Tó bá yẹ pé láti ìgbà tó ti bẹ̀rẹ̀ 8 days yẹn ló ti ń ṣe period yẹn, then that is normal for that particular woman. Ẹlòmíì ọjọ́ mẹ́wàá ni, ẹlòmíì ọjọ́ mẹ́ta péré, ẹlòmíì ọjọ́ méjì ni. Èyí tó bá ti mọ́ tó bá pé òun ni normal yẹn tó ti ń ṣe lágbà tó bá ti wá change tó pé ẹni tó ń ṣe ọjọ́ mẹ́ta tẹ́lẹ̀tẹ́lẹ̀ ó wá bẹ̀rẹ̀ sí ní ṣe ní ọmọ ọjọ́ mẹ́jọ, then that is going to lose more blood. So we have to look into it. Then the teenager needs to go and see the doctor. So we just want to be sure that everything is fine. Sometimes it happens like that. You just change cycle. It depends on the mood. Mood normally affects sexual flow. Or estrogen and the menstrual flow. So there's a problem, or the person is not happy, or the person is happy, it will definitely affect that flow of the blood. So then the teenager has to go and see the clinician just to be sure.
Shema, another question to Tiwa again. Is it normal for a person to be having clots with a period every month?
Clot is normal because about the physiology, the menstrual cycle itself, that's 28 days until man complete. Some people 28, some people 23, some people 22, whichever way is. The uterus is preparing to have a child. So the lining to allow the womb on full. So it's been ó prepare láti gba ọmọ. So bí ó wá cushion ara rẹ̀ pẹ̀lú blood vessels. So on cushion that area for 28 days, ló fi ń cushion ara ẹ̀. So tó bá di around the ovulating period, if the egg is not fertilized, ó dàbí pé okay, nǹkan tá à ń dúró dè kò tiẹ̀ wá. So the wall will break out. I will use that word for you to understand. Tó bá wá break náà lẹ̀jẹ̀ tá a máa rí lóṣooṣù yẹn. Pé okay o, ovary yẹn o, ó ti ovulate o, kò sí fertilization o, so it will come down as ẹ̀jẹ̀ tá a rí yẹn. So it will come as ara wọn clot kékèké in and out, which is fine, it's normal. Except if it continues and the clots are bigger or they change in color or their smell. In fact, you can actually think of menstruation one of these days. So if there's smell or there's so tabati ní àwọn nǹkan báyẹn, Islamically there's Islamic fiqh on all those things. But generally, all those little clothes, when they come in, it's normal for them to come in.
Another question, so how does okay, so for example, in marriage in tí ọkọ bá fẹ́ ṣe family planning, báwo ni ìyàwó ṣe lè go about it láti lè get a better result from the
Sherry, that's where when we started, we said this has to be a decision between the husband and the wife. They have to mutually agree. A woman cannot go into family planning without her husband's permission, and the husband cannot decide that, force the woman to go into family planning without her accepting that, okay, it has to be a mutual, agree professionally. So, tí ọkọ ò bá gbà and the woman is not well enough, and there's reason for her not to have another child, then she has to speak to him, and if he's not understanding, then we have go through the Islamic procedure of how to go about it. So we have to speak to the family, we have to go speak to the elders and get the normal people. Láti bá wa dá sí. Okay, with obìnrin yìí o, at this point in time, she cannot have another child. So they have to speak to the husband to make her see the reason. But tó bá yẹ pé obìnrin náà medically ni ò fi lè bímọ, or that is why she can't have another child, then we will now speak to the clinicians as to invite the husband and the wife and speak to them together and why she can't carry another child. But one thing we have to keep in mind is that as Muslims, if because nowadays, the Prophet ﷺ recommended we should have a lot of children to support us to grow and gain and things. So we should not decide that we are not having children. It is not an Islamic ethics. So may Allah make it easy for all of us.
Yes, ma'am. So another question is, at what age should a woman start contraception?
At what stage?
Age.
Age as in.
Age as in.
Okay.
At what age as in? Ọdún mélòó ni kéèyàn stop láti máa lo contraceptive?
That's why we started with contraception and menopause. So the way it works is this: a woman that continue to menstruate is likely to be pregnant. Okay, a married woman that menstruates is likely to be pregnant, and if they are not planning to get pregnant, they have to be on contraception. And age year, see the period stops or flow is different from the individual. Some women will continue to want to be more, want to stop, want to be by age 45, 50, what can they do? Because they thought that it is stopped, whereas the cycle is still on. So once a woman still menstruates, within a year, there's probability that that particular woman will still have a child, irrespective of the age. So she might be 51. If she continues to menstruate, probability why she will be normal. But if she's not ready to have another child, she has to be on contraception, or she have to be doing a mode of family planning with her husband. Otherwise, she will get pregnant. Do you understand the way it works? So the key to all this is period. Once a woman continues to menstruate, there's tendency to be batting she also. There's tendency pé yóò lóyún. The only reason tí obìnrin ò bá tí ò fi lè lóyún ni pé tí menstruation tí period yẹn bá ti stop for a year. And tó bá dẹ̀ ti stop for a year, then we class it as where that particular woman has gone into menopause.
Thank you.
That is it.
Another question, not Kantu Walensing. One can we ask our husband to watch this video for their understanding of our body?
Yes. It's fine. Yes, it's fine. Yes. May Allah make it easy for all of us. It's fine. And one thing that I wanted to emphasize about period, I know we don't have time, it's 7 o'clock. The fiqh of, just cut it in between, the fiqh of period if a woman continues to bleed, our scholars ní pé tó bá ti tayọ normal time tó kàn continue láti take stage kan, that particular woman has to láti lọ wẹ̀ ó dẹ̀ láti máa kírun. So I mean there's a consensus to about 14 days, and some scholars say 15 days. But at the same time, medically we say the person has the child or the person has to see a doctor, so that we have to add a lot of rule out pé kò sí anything to cause a problem tí yẹ kó obìnrin fi continue láti máa bleed, because tó bá bí continue láti bleed, that means that particular person is losing a lot of blood, so that person can fall into anemic, can be anemic, and I mean when someone is anemic setting, it can lead to so many things. So talking about the person lose the blood continuously, we might try to, as much as possible, see our clinicians. After 14 days, take your bath, your ghusl. I think we need to discuss ghusl as well. Your ghusl, then you start praying again. So may Allah make it easy for all of us.
Thank you very much, Ma. But I've got time to don't see.
Yeah, so we are at 7 o'clock, yes, that's why. Yeah, so may Allah make it easy for all of us. If there's any time, women, one of these discussions, we can bring a lot of Islamic fiqh into this. When we bring in Islamic fiqh and women fiqh into all of those things, then we can see the true picture, how it correlates with our lives. Because everything centers around our period, our body, and the way we do our things. So it's our body, when we get into menopause, it will affect emotions, the way we relate with our husband in the house, because there will be dryness of the private part, and that will cause a lot of problem between the husband and the wife. So all of those things are the things that we have to look into in future talks, so that we know that it is not as if the woman is saying yes. It's not as if the woman is saying no. There's something happening in our system that is making her not to feel the need of her husband anymore. So menopause sometimes normally cause all of those things. But once we're able to go and see our clinicians, they'll be able to solve all those problems between husband and wife as the woman grow older. So may Allah make it easy for all of us. Subhanaka Allahumma wa bihamdik. Ashhadu an la ilaha illa anta wa nastaghfiruka wa atubu ilayk. May Allah continue to make it easy for all of us. May Allah continue to protect us. May Allah continue to be with our families, our children, our parents, wherever they are with COVID-19. May Allah continue to protect us. May Allah continue to be with us. May Allah continue to protect us. May Allah continue to be with us. هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. قل أعوذ برب الفلق من شر ما خلق ومن شر غاسق إذا وقب ومن شر حاسد إذا حسد. بسم الله الرحمن الرحيم. أعوذ برب الناس ملك الناس لا إله من شر الوسواس الخناس الذي يوسوس في صدور الناس ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. السلام عليكم ورحمة الله وبركاته.
Wa alaikum salam.
Assalamu warahmatullahi wabarakatuh.
Ẹ ṣé gan ni alájà wa, ẹ ṣé gan
Assalamu
ni.
alaikum.
Ọlọ́run àti
Alaikum salam.
Alhamdulillah, adúpẹ́ lọ́wọ́ sísítà wa tí ó fi àsìkò ẹ̀ sílẹ̀ tó wá gbọ́ tiwa. Adúpẹ́ lọ́wọ́ sísítà wa, ọmọ wa, sísítà wa, Amira wa, Sherifat Kamal. You are a role model to Islam, both in Islamic jurisdiction and everything. Tá bá pè yín sílẹ̀ máa ń dá sí nípa health àwọn obìnrin. Agbọ́ gbogbo nǹkan tẹ́ ẹ sọ fún wa. Ẹ ṣé gan ni, Ọlọ́run á wà pẹ̀lú yín. Gbogbo ibi tọ́lọ́run ti ń pèsè ìmọ̀ fún yín, á máa lékun ní ìmọ̀ fún yín lágbára Ọlọ́run. Ẹ jèrè ẹ̀ láyé, ẹ jèrè ẹ̀ lálùkìámọ̀. Ọlá ìjẹ́kan ṣe Ọlọ́run. Subhanaka Allahumma bihamdika astaghfiruka wa atubu ilayk. Ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Ẹ ṣé gan ni, adúpẹ́ fún yín, ẹ ṣé.
Yes, sir.